I'm just going over it again because it's important. So, whenever we have a disturbance in homeostasis, which means what? The balance of the body. Alright, certain disturbances can develop. One thing is that we see is shock. So let's look at dehydration. So whenever somebody loses fluids, we tend to think they become dehydrated. And you can become dehydrated by just exercise, by being sick, or just by not consuming enough water, because your body is going to utilize water and excrete it, right, during the normal processes. We all know that because about 4, 5, 6 times a day, depending on how much you drink in a day, you go where? To the body. However, water is supposed to equal what goes in, supposed to equal out. That's one of the nurses, like on the little bags, the Foley bags, that's why they measure how much. If you have more water coming out than is going in, what's going to happen eventually? You're going to dehydrate. So if you have more water going in than is coming out, you're going to overhydrate. And that could be a sign of some kidney problems, right? Mm-hmm. So this happens, dehydration happens more elderly and in the very young. Very young, it doesn't take much. There's a couple episodes of diarrhea and vomiting and a baby's dehydrated. However, me, it may take a day or so. I may be able to handle it on my own. Signs and symptoms. Look, remember I told you about list, right? Decreased LOC, postural hypertension. What is that?
It means as you stand up, you lose your blood pressure.
There you go. Yep, we find that out by taking orthostatic vital signs. Remember that from EMT school? Orthostatic. Tachypnea, tachycardia, poor skin turgor, and decreased urine output. So overhydration can occur. You know, we see this sometimes in our dialysis patients, right? If you transport dialysis patients, or if you have to go out on them. I know, like the service at Newton, where I work at, we didn't do dialysis transports, but what we ended up doing was having to go pick them up afterwards because they were either didn't go to dialysis and were overhydrated, or they were dehydrated because they took off too much. So, and I've actually seen a patient in the hospital who was inadvertently given too much fluid and looked just like this. So how many of you here do dialysis transports? You ever notice before you take them home, what do? Weigh them.
They get weighed before and after.
Before and after, so they make sure they have the right balance before they leave. So our IV solutions, we're going to talk about those a little bit, but just to go ahead and let you know about IV fluids. IV fluids is, we get into a situation where we do not think that they are a drug. And they are just as much a drug as anything else. They have side effects and they have benefits to them. So don't use them like a benign tool, okay? Now the fluids that we use, the ions, are identical to those in the body. Now there are 2 camps out there, and I'm going to tell you, I don't subscribe to either one of them. There's 2 camps. You got people over here on this side who are nothing but lactated ringers. You have people over here that are nothing but normal saline. There's a time and place for both. I'm in the middle. Okay. So sodium, its main job is to help regulate our water levels in our body. And it helps regulate where they're at. So the IV fluids of choice that we have, do they have sodium in them? Yeah, all of them do. Normal saline has some sodium in it, right? How much sodium does it have in it? 0.9%. Not quite 1%, is it? Lactated Ringers, does it have sodium in it? Yep. Lactated Ringers is kind of like Gatorade or IV fluid. Lactated Ringers is actually more like blood in makeup than normal saline is. The problem with lactated Ringers is that it's not compatible with all blood being infused for an infusion. So sometimes there could be some problems. And the reason why is because of the preservatives. You know, whenever you go to the blood bank and you get blood, they put preservatives in that blood to help keep it longer. Also, there's preservatives in our saline and our lactated Ringers to help keep it longer. So some hospitals know exactly what preservatives are in their lactated Ringers, and they know exactly what preservatives is in their blood. So those hospitals may use lactated Ringers with blood transfusions. Some don't. For us, is that feasible? No. So like if we have a trauma patient, you should start an IV of normal saline and lactated Ringers. 1 and 1, right? If you have a bad trauma patient, you start 1 IV?
No, you always start 2.
You start 2. You should hang 1 on the Ringers and 1 of saline. Now we got one line that's ready for what? Blood. You got the other Ringers hanging. It's the way I do it. Some services you just have saline, you just hang saline. Problem with just hanging saline is if you give too much saline to a trauma patient, it can actually cause hypotension. The preferred fluid is lactated Ringers. But because of compatibility issues, it may not work. Now normal saline, we can work with that as well. But I've always had people say, oh yeah, but you know, saline's not compatible with blood. But when you go to surgery, what do you think a surgeon uses?
Saline.
They use lactated Ringers. Most surgeons are going to use lactated Ringers because it's more closely compatible with the blood that's in your body. So types of solutions. We have crystalloids. Can somebody give me an example of a crystalloid solution? Once again, normal saline or lactated Ringers.
Salt, sugar, and water.
A colloid. A colloid is a protein-based fluid. So there's a bunch of proteins in this. Now, do you think we use colloids in the field?
No.
No. It would be nice if we could, but the problem is storage and handling and expiration and stuff like that. That's why we don't carry blood. It's not, people will say, well, we don't carry blood because we're just, you know, it's not because you can't give blood. Giving blood's not that big of a deal. It's because of storage and keeping it. And plus, is blood a commodity? It is. I mean, we don't have an endless supply of blood, do we?
That's why they hold blood banks all the time.
Yeah, that's why they're always at Walmart wanting you to give it to them. Which has always been funny to me. I'll get on my soapbox for a second. They always want us to give it to them, right? But they make money off of it. Make a lot of money off of it. Wrong. You ever had blood infused in you? See how much they charge you? Yeah. It's like organ donation. They want you to give it free. But the person getting it is going to pay for it. A lot.
Unless you are giving it to that person.
So isotonic, that's going to be our, once again, anybody? Normal saline, lactated Ringers, D5W. So that means it's closely, right, resembles us. Hypotonic, that's going to be something that is like in lower concentrations, right? And hypertonic is going to be higher concentrations. Because they have D5 half, D5 and a half. They have D5 and a quarter saline. They have a quarter normal saline, half normal saline. So you can have. So, let's talk about starting IVs. Whenever you start an IV, and I cannot emphasize this enough, you have got to keep it as sterile and clean as possible. If you touch the needle part, throw it away. If that needle, if you do not double stick someone with the same needle, if that needle comes out of their skin, you throw it away. Now this is coming from someone who has had phlebitis. And it is not fun. It hurts, and it takes a while to get rid of. And it can be dangerous because you can get blood clots. And that, if someone gets phlebitis, that is, you just broke one of our #1 principles, right? Which is, do no harm. And just because, why would you double stick? Is there ever an excuse to double stick somebody with a dirty needle? No. Just laziness. That's it. Throw it away, get another one. And, you know, they're only $1. Some of them may be $2. If your service can't afford it, then they need to do something else. But try to use be as sterile as possible, alright? So have some forethought about what you're going to do. Set things up. Just don't, you know, start throwing things around and slinging things around. If you drop your needle, don't pick it up and use it. I've seen somebody do that before. And I'll let off in them too, because I couldn't believe what I just saw.